can you address how at least the hospital systems in the United States support families, and then the whole issue around how do you include a psychologist in the team prior to transplant and then after, or curative therapy, and then weeks to months to sounds like even years after curative therapy?
Sure. Thank you, Michael. So it's really important to remember that cure is not enough, and we really need to think about that. That phrase was actually coined by a now deceased but very famous radiation oncologist at the Children's Hospital of Philadelphia, Dan D'Angio, in 1975. So in 1975, that's when we started to actually truly move the needle and start to cure the majority of children with certain types of cancer. But what we found was the therapies that we used to cure those children were the same therapies that were associated with long-term effects. And it took a long time before we started really paying attention to not only the physical long-term effects, but the psychosocial effects of the illness, the treatment, and the entire treatment experience. Unfortunately, there is a shortage of mental health across this country. And there is also a shortage of people in the mental health field who truly understand what the medical ramifications are of things like stem cell transplant, gene editing, gene therapy, and in fact, very few who really understand what happens for a patient with sickle cell disease. So what's been happening is academic medical centers, cancer centers have largely been recognizing this. And we've always had social workers as part of our team. Those people are really there to help with resources in the community, in the hospital, et cetera. But what's been missing from teams has actually been embedded mental health care. This is very important. However, it's something, honestly, that's not very well reimbursed by insurance. And what nobody wants is now for the patient who's gone through a stem cell transplant to have very large additional bills for mental health care. So we have worked across the cancer and hematology communities to really promote psychosocial health. And this has really started both in children's hospitals and adult hospitals. So for example, in Vanderbilt, on both the pediatric side and the adult side of the street, so to say, for cancer and blood disorders, we have embedded mental health care. So for our pediatric oncology team, we have 2 psychologists that are 100% dedicated to our patients. And those psychologists that are available to see the patient the day they're diagnosed with a cancer, or see the patients who are being treated for sickle cell disease with disease-modifying therapies, to meet with families as they're starting that transplant process, and then to be available to them throughout the entire process and afterwards. And while 2 psychologists obviously can do in-depth counseling and treatment of hundreds of children a year, they can be that liaison, and then they can help find additional resources in the community. So many of these resources are actually paid for through philanthropy. So very generous donors give the hospital money specifically for this, which helps offset the costs and then takes away the onus of a patient having to pay for these services